name is Karen Motley. I will be your tour guide today. I have been a health information management professional for 25 years. I started my educational endeavors graduating from a 2-year community college and then proceeded on to get my RHIT credentials. Continued again, went to a 4-year university, obtained my RHIA credentials, continued on one more time, and have now obtained my MBA degree. Today we are going to tour a facility. It's a 310-bed healthcare facility. It has many services to include medicine, surgery, rehab, sports med, OB, newborn. This facility is also accredited by Joint Commission on Accreditation of Healthcare Organizations. Just to give you a feel for the activity of this facility, they have over 12,000 admissions per year, over 55,000 ER visits, over 8,500 outpatient surgery visits, over 3,000 observation visits, and over 175,000 outpatient registrations. Did you know every time a patient frequents the hospital that a medical record is created? Usually, used to be, that medical record was actually created on paper. Now, like everything else, that system is going to a paperless system and it's maintained electronically. At this facility, we are going to tour the medical records department. Now, at other facilities, you may hear the medical records department referred to as the health information management department. The management team in this department consists of 1 director, 1 assistant director, 3 team leaders, 52 medical record employees, and 35 transcription employees. In this facility, as in all facilities, the code of ethics is very important. At this facility, each employee must sign a confidentiality statement upon hire and then also once a year. Confidentiality is of utmost importance, not just for your health information management professional, but also for any healthcare professional. Breach of confidentiality will warrant termination of employment. Continuing education is very important in healthcare. Each employee is required to complete all hospital mandatory educations. These subjects can include anything all the way from electrical safety to fire safety. Depending on the position an employee holds, they also will be required to complete all educations in order to maintain their credentials and also anything that is required by department requirements. Come on, let's begin our tour of this facility. Here at this facility, our medical records department is divided into 2 sections. Physically, our department is split by a hallway. On this side of the hallway is the medical record side. On that side of the hallway is the transcription side. Our office hours are normally 8 to 4:30. This is when the public can come in, get copies of their medical records, or enter into the department for whatever they need. However, at 4:30, the doors automatically lock and only authorized personnel are allowed into our department. It's a secured department. In order to get into the department, you have to have a name badge that authorizes you to get in. Inside this name badge is a computer chip. This computer chip knows who's allowed in, who's not allowed in. In order to get in, you take your name badge, swipe it against the entry pad, and then once you hear the click, you know you're allowed in. In this area of our department, this is what we call the release of information. The responsibility of this department is to assure that customers, as they come into our department, that they are taken care of. Patients come in requesting copies of their medical records to be sent out. Another really large responsibility of this section is to assure that as authorizations come in, they can come in from physicians, attorneys, other hospitals, that the patient has authorized for release of their medical information. We make copies of that information and then ship them out to the person who has requested them. One of the really important procedures that occurs in this part of our department is answering subpoenas and court orders. It actually requires a health information management professional to answer these subpoenas and court orders. The professional gets the record ready, actually goes to court, and appears on the stand to deliver those records to the judge. Also in our department, we have the equipment that is very typical of most office settings. We have the copier. Although we have made the transition to the paperless medical record, all of our history, all of our old medical records are still on paper. Therefore, as someone requests a copy of their medical records, we must take that record, copy it, send it out as requested. Also part of our copier machine is also a fax machine. It's called a multi-purpose device, and you can fax or copy on the same machine. Another piece of equipment that's really important in our department is the shredder bin. Anytime a record or a paper has any type of a patient identifier on it, a name, a medical record number, that piece of paper cannot be put in the trash can. It must be put in the shredder bin for confidentiality purposes, for HIPAA purposes. Therefore, you know that nothing's going out in the trash that could identify a patient. One of the most innovative software applications that we use in our department is called autofaxing. Jessie, you use autofaxing frequently in your role in release of information. Can you tell us how that works?
Well, here at this facility we have the electronic medical record. We also have the capability to fax medical documents straight from the computer without having to physically take the paper to the fax machine or copier. This process is very simple. I pull up the patient's electronic medical record on the computer. Then the next step is to choose which documents you would like to fax. With a click on the computer, I then use the autofaxing software to fax the documents to the appropriate recipient. Using autofax has been a tremendous time saver for the release of information department. The turnaround time has gone down tremendously, and with autofaxing, I don't have to retrieve the paper chart, take it to the copier or fax machine, and then refile it back. Autofaxing has made my job tremendously more efficient.
That sounds great, Jess. Thanks. All departments are required to maintain departmental manuals. All manuals are to be accessible to all employees at all times. These manuals contain anything from emergency preparedness manuals, infection control manuals, all the way to the specific departmental policies and procedures. It is a requirement that all manuals be accessible to all employees at all times. These are here in paper. They also are available online, so those working from home can also have access to them. Now this is the scary part of the department. We call this the room of many papers. All of these medical records have been scanned to optical disc. These paper records came to our department, we scan them, and then we maintain them in paper form for 3 more months. After 3 months, all these medical records can be shredded. All of this is now this. This machine is called the reader printer. In the past, in order to save space, medical records were transformed into a different format. The paper was transformed into roll film, or with newer technology, it was actually transformed into microfiche. Microfiche is essentially roll film cut up and placed into the sleeves of the microfiche. The reader printer allows information from this technology to be read and also will allow a paper product to be produced if that becomes necessary. This is the cancer registry section of our department. Shelley, can you tell us a little bit about the cancer registry?
Sure, Karen, I'd love to. Cancer Registry is responsible for the collection, management, and analysis of data on individuals with with a diagnosis of a malignant or certain benign neoplasm. The cancer registrar is responsible for determining that all data collected is accurate, timely, and useful. Data collected includes but is not limited to demographics, diagnostics, treatment, and outcomes information. The collected data is then submitted to the State Central Registry and the National Cancer Database. Cancer registry data is used by the public health officials to determine if optimal care is being provided to patients with a reportable diagnosis, assess patterns of referral, improve patient outcomes, determine the need for professional and public education programs, and also how to best allocate their resources. Hospitals use the data that I collect to meet regulatory and accreditation requirements, analyze diagnosis, treatment, and follow-up, provide information in regard to the facility's cancer program, and also develop education programs for patient health care professionals and general public. In some facilities, cancer registry is not located within the medical records department or even considered part of the medical records department. In these cases, the registry is considered their own department and will usually report to somebody in the oncology services. If someone's interested in being a registrar, it's very important that they understand anatomy, physiology, disease processes, medical terminology, and of course be very familiar with the computer applications. Most facilities require the cancer registrar to have either a 2-year healthcare experience or a health information management degree. Most facilities would also prefer to have a credentialed CTR, which is a certified tumor registrar, and requires passing a national exam. Being a tumor registrar provides individuals and myself with a variety, flexibility, opportunities while always learning.
Thanks, Shelley. That really fills in the blanks. Let's move on. This is the coding section of our department. In order to be a coder here, basically you have to have 3 requirements. 1, you have to be a graduate of at least a 2-year HIM, Health Information Management program. You must pass 2 coding exams, and you must pass a medical terminology test. Beth has been a coder here for many, many years. Beth, can you tell us about what it's like to be a coder here?
It's wonderful to be a coder here. I love what I do. I love the excitement. I love the challenge. Coding is a field that is constantly changing, and what we do in coding is we review the entire medical record, and we assign numerical codes from the IC9-CM and CPT coding systems, and we give a number code to each diagnosis and in each procedure based on what the documentation in the medical record is. One of the better things about this job is that once you think you've learned a feat or mastered something, you know it's going to change and you're going to be challenged, and it's something that's very exciting, and it keeps the job very interesting. But typically when we begin coding a medical record, we review it electronically, and we assign the codes, and then that goes to the billing process and then to the patient's insurance carrier. Coding is really important based on the financial reimbursement aspect of it. Since the codes actually impact the hospital's reimbursement, then we have to be very accurate, and we have to be very concise, and to code all the diagnoses that are listed on the patient's account that are pertinent to their hospital stay. One of the more exciting things that we do here at the hospital is we have a remote coding program, which means the coders can code from home, and they love it. It's something that we've tried to have for a long time, and there's a lot that you have to do to prepare for that, and it's an exciting thing. The coders love being able to have that flexibility, and for the hospital, it's a great thing because it helps with our recruitment of coders as well as our retention of seasoned coders. And since there is such a big demand for coders right now, it's a very big bonus for us to be able to offer that. So one of the really important things to remember in coding is that you have to be very accurate, because it's important not only for reimbursement for the hospital, but it is also very important because that's a patient's medical record, and this information is sent to the insurance carriers, and it's something that they will carry with them for life, and it can have a big impact on whether a patient can get insurance or things like that. So it's a very important job.
Tell me about this book.
Well, Karen, this is the ICU-9 code book. It includes diagnoses and procedures, and as you can see, it's a very heavy, very large book, and we do use this code book as a great reference. We have to refer to the code book often, and it's very easy to use. It's broken down in the different tabs, and it's very user-friendly, and it's they call it our coding Bible.
So, Beth, how is it reading physician handwriting day after day?
That's probably one of the biggest challenges for coders, whether you're a new coder or a seasoned coder. It's something that, you might learn a physician's particular style, but there are always new physicians coming on staff, and there are always changes, new drugs, new therapies, new treatments, and so it can be a real challenge to learn and to read the physician's writing. But that's one of the parts that makes it very interesting.
So you like your job as a coder?
I love my job, Karen. I have worked for 25 years in the medical record field and in the health information management, and 15 of those have been in coding, and so it's been very exciting, very challenging. Things have changed tremendously since we first began, and coding is something that's always going to change.
Thanks, Beth.
You're welcome, Karen.
This is the central files section of our department. Our central files holds all the many, many papers that are in our department. Darlene.
Yes.
Can you tell us a little bit about central files?
Sure. First of all, as Karen stated, we have many, many records. What we do with the central file is, first of all, when I have a record to look up for a patient, I look it up on the computer to see where it is located in our localized filing. Once it's located, it could possibly be in another department, or it could be here in the files. Once I find out it's in central files, what I do is I come back, get the record out, and what we have here is what's called terminal digit filing. With the terminal digit filing, that means that we have color-coded filing. It's on the last 3 digits of the number. Once we find that area, then we go in and look at the first 3 numbers, which are in numeric order.
Darlene, your record's really thick, lots of papers. Why is that so thick?
Well, we have what is called a true unit record. Anytime a patient occasions our hospital, they will get one chart for how many ever visits they come in, one chart, one number.
Hey, Darlene, let me hold that for you. Do you mind showing our group how to use these movable files?
Sure, I'll be glad to. First of all, you have your green button here, which is to open, the red button, which is to stop it. But before you press the green button, you have to make sure that there are no coworkers inside. Once the coast is clear, you go ahead and press the green button. It will open up, and once you do that, you check for the file. If you have forgotten to look to see if there is a coworker inside, there is a safety feature down at the bottom. That person inside can just kick that safety feature and it will stop immediately.
Darlene, thank you so much. Here, your chart back. I really appreciate your help.
You're welcome.
Now, Darlene mentioned the safety features in central files. A couple other features worth mentioning is anywhere in the hospital that paper records are stored, it is a requirement that you have overhead sprinkler systems to diminish any damage that could happen should there happen to be a fire. The other feature about central files that's worth mentioning is even though you've seen many, many rows of medical records, this isn't all of them. at all. This is only the tip of the iceberg. This is 2 years worth of active records. The many, many more rows of records are in our remote storage, which is in another floor in our hospital. This is the optical disc scanning portion of our department. In the storage of the electronic medical record, most of the documents are created on computer and then they go over to the electronic medical record automatically. They're interfaced. However, there are papers that are not created on the computer and they need to be scanned into that medical record. That's what the optical disc scanning is for. The documents are actually prepped, means you make sure there's no staples in them, make sure the document is not frayed. Put the document into the document feeder on the scan machine. It feeds through just like it would for a photocopy machine. The document image is then stored. At that point, the next step is to quality review it, where we actually look at the document on the screen, make sure that it's straight, it's readable, and that it looks like a nice document that can be reproduced. The final step is to actually index the document. The scanner personnel has to take the record, look at the image, and then actually find the medical record and the account number that it matches and electronically connect those so that that document then goes over into the appropriate medical record for that patient. Although our records now are in electronic format, prior to that there was many papers, many paper records, and we still have all of those paper records. If a physician or a healthcare provider needs access to that paper record, we are still responsible to get that paper from our department to the point of care where that patient is. What this means to our medical record technicians is they have to actually pull the record and send the record up to the point of care. When those records come back into our department, we have a pre-file shelf that we put them on. At this point, that pre-file shelf houses the records until they're ready to be filed in central files. This is the analysis area of our department. Regulatory bodies require that specific documentation is on each and every medical record. The analyzer in this part of our department actually looks at each medical record as it comes to our department and checks each and every form for any deficiencies. If there are deficiencies found, the analyzer will complete a tab and then actually go to the point of marking, tagging that deficiency so the doctor knows exactly where to sign or what to complete. This is the transcription side of our department. In transcription, we type, we transcribe the doctor's dictation, and actually those create documents that are then sent to the floor. In order to be a transcriptionist in our department, there are basically two requirements. One is you have to be able to type at least 65 words a minute. The other requirement is that you have to be able to pass a transcription test. That transcription test actually consists of 3 documents: a history physical, a discharge summary, and an operative report. You have to be able to successfully pass that test in order to be a transcriptionist here. Now, in our facility, we have about 80% of the transcriptionists that actually work at home and 20% still work here on site. The people that work here on site are usually by choice. Either they're a transcription trainer or they want to work here on site. They don't want to be at home. They don't like the isolation. But with the 80% that actually work at home, they are usually doing that by choice. We've actually got Becky here, who is one of our home transcriptionists, came and just to help us out with the tour today. Becky, could you tell us just a little bit about the what you like and don't like about being a home transcriptionist?
Sure. I've had the opportunity to work in-house and at home, and when I first went home about 2 years ago, it was a little bit of an adjustment. I missed the camaraderie with my friends here. Takes a lot of self-discipline to work from home, but soon I began to realize the benefits to working at home, including those snowy mornings when you don't feel like driving in the snow. Your wardrobe doesn't have to be professional. You can work in your jammies all day if you want. Saves on expenses for your clothing, gas mileage, meals. It just suits my lifestyle. I like it.
Thanks, Becky. A couple other aspects that you may find interesting about our department are the other requirements of a transcriptionist. Transcriptionist must maintain 1,000 lines per day productivity rate. They also must maintain a 98% accuracy rate. In other words, you have to type fast and you have to type accurate. Another interesting fact about our department is the way documents are actually delivered to the nursing floors. When a transcriptionist is transcribing and she hits that send button, that save button, it automatically sends that document to the point of care. Therefore, the health caregiver that is there on the nursing floor gets that document immediately, gets that information immediately, and can use it for the health care of the patient. Now let's move on to our next department. I am now in front of the TQI board. TQI is an acronym that stands for Total Quality Improvement. At this facility, quality is greatly valued. Measurements are continually made of quality and all the processes that are going on, and they are continually assessed and measured. This is a visual display of all the measurements that are currently happening at this hospital. Also, I have a display of the emergency management codes. The emergency management code names are consistent at all healthcare facilities throughout the state. For example, Code Red stands for fire. Code Yellow indicates a disaster. As a reference for every employee, on the back of every employee's name badge is a list of each code and each code name for a reference. Also in this area we have the office for the Director of Health Information Management. We have a conference room for employees to meet. We also have the lounge for employees. At our facility, this is the Physician Incomplete Record area. This area is located right next to the physician lounge, which is on purpose because most physicians do not like to complete their medical records. However, at the lounge right next door, there is food. So the goal here, the enticement, is to hopefully as the physicians come in to get a snack, they'll actually come in and complete their medical records. Tammy, can you tell us a little bit about this area?
Sure, Karen. This is the Physicians Incomplete Chart area. We receive information from the analyzers in this area, and the analyzers are responsible for reviewing the chart and looking for deficiencies. They look for dictation or for missing signatures, and then they forward the documents up to this area, and they place them in these folders for the physicians. As you can see, they're listed by physician's name, and they're in alphabetical order. And then the physician comes in, and he will pull out his folder, and he will take it to a dictation area, which also has a PC, which they can look up the electronic medical record information. This will help them complete the charts. After they complete the charts, they will forward those documents to the analyzer in this area. She will take that information and look to make sure that it's been completed. When it has been completed, she'll update the computer so that the physician will not have a deficiency any longer. And then if the document has been altered, she will forward it down to the department so that it can be rescanned. And after it's rescanned, then it's available for everyone to see. And it's a very interesting job because they get to work with the physicians, and they are really needed up here. And if you are interested in some kind of job like that, that would be great for the health information management professional.
Great. Thanks, Tammy.
Thank you, Karen.
While every health information management department may not be organized exactly as this department was, the functions are very, very similar. As you've seen, there are many different component parts all working together with a common goal of assuring that the medical records are completed in a timely fashion to assure that medical information is given to healthcare providers and others who also need that information. The Health Information Management Department offers many diverse and unique opportunities for the health information management professional. I want to thank you for your interest in this profession, and I wish you the best in your educational endeavors.